As crises are not resting in our city. It seems as though people say that, your honeymoon period is over. There was never a wedding. we have been, we have been going at it since the day we took office with an amazing team doing some amazing things. And one of the crises we're facing, and it's a real crisis, is the mental health crisis. It was a problem prior to the pandemic, and it has just continued to be aggravated post-pandemic. And so I want to thank the Deputy Mayor who has taken upon this awesome responsibility of navigating the team that was put together to deal with COVID, mental health illnesses, and those pre-existing healthcare crises that we were facing. The presence of COVID did not mean the absence of some of the crises that we were facing. And so we also want to thank our electeds that are here, real forward-thinking elected officials who have been in this line of work, particularly Councilwoman Mercedes Narcisse, who was a former nurse, and just continued to lean into these healthcare issues that we're facing, and Senator Cordell Clear, who represents the village of Harlem and Harlem born through and through. Every New Yorker deserves a healthy and productive life, and that's what this announcement is about. Free from anxiety, free from depression, alcohol abuse, and substance issues, and more. And we're just seeing an increase of this as we move around our city. But 2 years of global pandemic have created a behavioral health and substance use crises in our city. And it's reflected the last time I was here in this space. Two officers, Officer Rivera and Mora, who were assassinated. Clearly the person involved had some form of mental health issue. Those stairs were lined with police officers who felt the impact of the loss. And outside to the left, we saw a countless number of people from Harlem was just looking in to see that devastating impact. And the effects of the mental health crises we're facing is disproportionately among Black and brown communities. But as we say over and over again, superheroes are not only wearing capes, they're wearing white coats. There are nurses and doctors. There are mental health professionals that are the superheroes of our time. They're the psychologists and licensed social workers, and they are helping people with troubled lives. And we sometimes forget that because you become a professional, it does not mean that you don't have personal crises as well. The impact of COVID, visiting the hospital, seeing some of the nurses and doctors and psychiatrists who were dealing with their own crises at home, losing loved ones. The infection of COVID did not skip over you because of your profession. Many of them lost loved ones, they lost family members. While they were in the hospital, they were concerned about at home, and they were concerned about infecting their family members. And that's why we're pleased to announce today New York City Health and Hospital new behavioral health loan forgiveness program. Funded by a $1 million grant from a generous and anonymous donor. It offers $30,000 to $50,000 to student loan forgiveness to mental health professionals commit to serve in the New York City public health system. And we just want to thank that donor. All New Yorkers, thank that donor. And it's a seed amount. We're calling on all New Yorkers who, at 7 p.m. every night during COVID, were giving handshakes and giving claps to the success of our healthcare professionals. We're calling on them now to go to the website and donate. We should continue to feed this donation for our mental health professionals. Every New Yorker deserves the right to receive behavioral health care for the serious mental health illnesses we're facing, and this is a way to do so. And why is it important? Because many of our practitioners have no choice but to work in private sector because of debt after graduating. We're losing so many healthcare professionals. It is reported in one study 30 to 60% leave each year. The debt is real. On average, $190,000 for medical school, $80,000 for psychologists, $68,000 for social workers, and $56,000 for psychiatric nurses. And they say over and over again they want to serve in the community. We hear it all the time. But the cost of serving in the community in high student loan debt makes it challenging. And this is a tragedy, and we expect better from a city like New York. And this donor is clearly stating they observed what the city was doing, and they wanted to do their part. And we're asking others to do our part. I'm going to personally make a contribution, and a small contribution from 8.8 million people becomes a big contribution. Anyone that had to experience hospitalization, or who had to visit a hospital, or who had to go and receive a vaccination, we should all in some way give a small contribution and to keep our mental health professionals right here doing what they love to do. It should not be a barrier because of a student loan. And so with the Behavioral Health Loan Forgiveness Program, heroes can now get back to doing the job that they love, and that's serving the people of this city. Behavioral health concerns can be treated. Alcohol and substance use disorders can be treated, and treatments turn lives around. Every time we hear of someone who has gone through some form of treatment, how it has turned their lives around, it really shows you the power of our mental health professionals. It takes people off the street. As we move to our homelessness problem, there's a substantial number of people who are dealing with mental health issues, and it needs to be a combination of having adequate health care professionals, treatment facilities, and allowing people to return home in their normal lives, get back to work, get back and reunite with their families, and start the process of healing our city. So we are grateful to Dr. Katz and H&H for this contribution and this donor. And we want to, again, encourage all New Yorkers to participate in this donation and continue to watch this pot grow. You could donate at NewYorkCityHealthAndHospitals.org/BH4 New York City. That's New York City HealthAndHospitals.org/BH4 New York City. Let's get this done. Let's keep our mental health, behavior health professionals here in our city. And again, great work by the team in getting this done. Thank you very much.
Thank you. Thank you so much.